Welcome to the deep dive. Today, we're tackling a subject that hits close to home for a lot of pet owners, the weight and health of our dogs and cats.
It's such a common issue, isn't it?
It really is. And you might think a little extra weight is okay, maybe even cute, but our source for this dive, Canine and Feline Obesity Management, paints a much more serious picture.
Absolutely.
So our mission today is to really dig into this source, pull out the crucial bits to help you understand, spot, and manage weight issues in your pets, going beyond just how they look.
Looking at the actual health impacts.
Exactly. Okay, let's get into it. I'm actually really interested to uncover some of the maybe less obvious sides of this.
Yeah, it's interesting because the source defines obesity pretty clearly. It's not just being a bit heavy.
Right.
It's specifically having an excess of body fat that can genuinely cause health problems, even, shorten their lifespan. Even a moderate amount matters.
It's that hidden impact. Okay, so the source jumps right into the why, the pathophysiology now. We kind of know the basics, right? Calories in, calories out.
But what are some of the modern lifestyle things that really mess up that balance for our pets today?
Well, several things pop up. Neutering, for example. It's often necessary for other reasons, but it can sometimes slow metabolism a bit, maybe increase appetite.
Okay.
And then you add in maybe a less active indoor lifestyle, lots of easy access to food. It's easy to see how the weight can creep on.
Yeah, that makes sense.
But what's really key are the secondary problems, the stuff happening because of the extra weight, not just the weight itself.
Right. It's not just the physical load.
Mm-hmm.
The source mentions increased inflammatory mediators, oxidative stress, even insulin resistance. What's actually going on there?
So fat tissue isn't just like padding, it's metabolically active.
Mm.
In an obese pet, this tissue gets infiltrated by immune cells, macrophages.
Okay.
And these macrophages, along with the fat cells themselves, start pumping out these inflammatory and endocrine signals. Things like tumor necrosis, factor alpha, resistant interleukins.
Wow. And these substances are what cause trouble. They can interfere with how insulin works, leading towards diabetes, and they also contribute to those painful joint changes, the arthritis we often see.
So it's like a low-grade inflammation simmering throughout the body.
Exactly. It's a systemic thing.
And the source lists, the main systems, hit hard, endocrine, musculoskeletal, but the secondary problems, that list is long.
It really drives home why healthy weight is so important. Obese pets have a much higher risk for, a whole range of issues. Diabetes mellitus, definitely.
Yeah.
Orthopedic problems, joints, mobility, skin conditions, urinary tract disease, even problems with the liver, heart, and kidneys. It affects almost everything.
It really does put it in perspective. So
Yeah.
who's most at risk? The source breaks it down a bit. Dogs and cats, obviously.
Right, both species. But it really peaks in middle-aged animals. The source says nearly half of pets in that age group might be overweight or obese.
Half. Wow. That's huge.
It is. And it might be that their activity naturally dips a bit then, or maybe feeding habits have just added up over time.
Makes sense.
The source also flags neutered indoor pets as being more likely to be affected, which ties back to that energy balance thing we talked about, potentially lower energy needs, easier access to food.
Okay, so if you've got a middle-aged, neutered, indoor cat or dog, you should be extra watchful.
Definitely something to keep in mind.
So how do we spot the signs? As owners, what clues should we be looking for maybe before it becomes a really big problem?
Often the first things are subtle. Maybe just gradual weight gain, it creeps up. Or maybe they seem less keen on exercise, get tired more easily.
Like getting puffed out on walks sooner.
Exactly. Or your cat just isn't playing as much. Then, when you actually feel them, that excess fat layer is the most obvious physical sign. And that's where the body condition score, the BCS, is super helpful.
Ah, yes, the BCS. The source really pushes this over just using the scale. Can you walk us through how that works?
Sure. It's basically a hands-on assessment. You look at their shape from above. Do they have a waist? You look from the side. But crucially, you feel specific areas.
Like the ribs.
Yeah, the ribs are key. You should be able to feel them easily with just light pressure without a thick layer of fat over them. Kind of like feeling your knuckles when your hand is flat.
Okay.
You also feel along their back, the lumbar area, and around the base of their tail. The source uses a 9-point scale. Ideal is usually a 4 or 5.
And higher is more fat.
Right. Each point above ideal represents about 10 to 15% excess body fat. So a BCS of 7 or more generally means the pet is obese.
That's a really practical tool. Feel the ribs. Got it. And the source mentions briefly that sometimes a pet looks bigger for other reasons.
Yeah, good point. It's not always fat. Could be pregnancy or fluid buildup, maybe even a tumor. That's why, a proper check by a vet is really important for a diagnosis.
Absolutely. Okay, so we know what it is, the risks, how to spot it. Let's talk solutions. How do we help them get to a healthier weight? The source is clear, calorie deficit.
Yep, taking in fewer calories than they burn. Simple concept, but
Harder in practice.
can be. And the source stresses this isn't a quick fix. It's about long-term change, not just losing the weight, but keeping it off. And that usually means owners making real changes to feeding habits and daily interactions.
Which leads straight into client education. Getting owners on board is crucial, isn't it?
Totally essential. The source highlights a few steps. First is just recognition. Seriously, many owners just don't see that their pet is overweight.
Really? Maybe they're just used to seeing them that way.
Could be. So using that BCS score, actually showing the owner how to feel the ribs, that's step one. Then explain why it matters. Not just looks, but the risks, arthritis, diabetes, urinary issues, shorter life. That's a motivator.
Connecting it to their pet's actual health and lifespan makes sense. And then involving the owner in the plan.
Yes. Getting their input. What's their routine? What food are they using now? What's realistic for them to change, especially if there are multiple pets? That can be tricky.
Feeding them separately, maybe?
Sometimes necessary, yeah.
Yeah.
Then there's compliance. Making the instructions super clear. Written down exactly how much food. Using a standard 8-ounce measuring cup.
Not just scooping vaguely.
Right. Or even using a kitchen scale for small pets where tiny amounts matter. And I like that the source includes treats. Don't just work them into the plan. A small daily allowance.
Makes it more sustainable, probably.
Exactly. And finally, ongoing communication. Regular check-ins, follow-up is key.
That support sounds vital. Okay, let's get specific about diet. What actually goes in the bowl? The source talks about macronutrients, protein first.
Yeah, protein's important during weight loss. It helps the pet lose fat, but keep their lean muscle.
Which burns more calories, right?
Muscle, exactly. It keeps their metabolism more active. Helps with long-term control. Plus, protein can help them feel more full, more satisfied.
Less begging, hopefully.
Right.
Okay, what about fiber?
Fiber's useful too. It's low in energy itself, so it bulks up the food without adding lots of calories. It also helps with digestion and, like protein, can increase satiety, that feeling of fullness.
Good stuff. And then less fat. That seems obvious.
Pretty straightforward, yeah. Fat is packed with calories, so reducing it is a major way to lower the energy density of the food.
Makes sense.
And the source also mentions increased moisture, like in canned food. More water means fewer calories per bite, basically. Allows for a bigger meal volume, which can be really helpful, especially for cats sometimes.
Oh, interesting point about cats liking volume. The source also touches on carnitine and isoflavones.
Yeah, briefly. Carnitine helps the body use fat for energy. Supplementation might be considered in some diets. Isoflavones are plant compounds. Some research suggests they might help maintain muscle during weight loss or reduce weight regain.
So, potentially helpful extras.
Potentially, but the main thing is still that balanced, calorie-controlled diet, which is why the source often points towards therapeutic weight loss diet.
The prescription ones.
Usually, yeah. They're specifically formulated low-calorie, but with increased levels of protein, vitamins, minerals, so the pet doesn't miss out on essential nutrients while they're eating less overall.
Gotcha. And how fast should they lose weight?
The guideline is slow and steady, about 1 to 2% of their body weight per week. Any faster, and they risk losing muscle mass, which isn't good, and they might be more likely to regain the weight later.
Okay, 1 to 2%. And how much food do you start with?
It's an estimate to begin. The source suggests calculating their daily energy needs, their MER, based on their ideal target weight, or maybe an intermediate goal weight if they have a lot to lose. Then you feed about 60 to 75% of that calculated amount.
And it gives some average numbers.
Yeah, rough starting points. Around 55 kilocal per kilogram for cats, and for dogs it's a formula, 110 times their weight in kilogram to the power of 0.75. But these are just starting points.
You have to adjust based on the actual pet?
Absolutely. Every animal's different. Their metabolism changes as they lose weight too, so regular weigh-ins, usually monthly, and adjusting the food amount based on their progress is essential.
Right. And you mentioned canned food for cats again.
Yeah, the high moisture content is often really beneficial for them, helps with satiety and overall calorie reduction as fed.
What if someone really doesn't want to use a therapeutic diet?
The source offers advice there too. Avoid really drastic cuts. Maybe use a food diary first to see exactly how much they're eating now, including all treats. Then aim for maybe a 10 to 20% reduction from that current intake.
Still measure carefully.
Oh, definitely. And treats still need to be factored in. That 10% daily calorie allowance is a good guide and suggests low-calorie options, bits of carrot, green beans, that kind of thing.
Okay, that sounds like a solid dietary approach. But diet's only half the story, right? Activity is crucial too.
It really is. Cutting calories can sometimes slightly slow down their metabolism, their basal energy expenditure. Increasing activity helps counteract that.
Keeps the engine running a bit faster.
Exactly. Plus, it's just great for bonding. The source has loads of good ideas.
Yeah, like leash walks for dogs, obviously, but even for cats if they're trained.
Some cats will.
Playing fetch, interactive wand toys for cats, laser pointers. Though you have to be careful with
Let them catch something at the end, yeah.
Right. And food balls or puzzle toys are great too. Makes them work for their meal, slows them down. Just use food from their daily ration.
The key is finding something the pet enjoys and that fits the owner's life, making it a regular thing.
Consistency. Okay, what about medications? Is there a magic pill?
Not really, no.
No.
The source is clear. Currently, in the U.S. at least, there aren't any approved drugs specifically for pet obesity management.
So it really comes down to diet and lifestyle changes.
For now, yes, which loops us back to follow-up, that ongoing support.
The source really hammers this home, doesn't it? Frequent communication is vital.
Absolutely. It suggests a schedule, maybe a quick phone call after the first week, just check in, answer questions, offer encouragement.
Keep the motivation up.
Yeah. Then monthly visits for weighing, assessing their BCS, and adjusting the food allowance based on progress.
And then what happens when they hit the target weight? Is it job done?
Not quite. Maintenance is the next phase, and often the hardest. Their energy needs will likely stay lower than before they gain weight, maybe creeping up just slightly over time.
So they can't just go back to eating like before.
Definitely not. Owners need to keep measuring food carefully, keep monitoring their body condition, maybe weigh them regularly, and be ready to adjust the food if the weight starts creeping back up.
It's an ongoing management process.
It really is.
Okay, so wrapping this up, managing pet obesity, it's a whole package deal, isn't it? Diet changes, more activity, constant monitoring adjustments, and it all hinges on the owner really understanding and committing to it.
That's the core message. And recognizing it's a true health issue, a disease state, not just about looks.
So thinking about everything we've discussed, the internal changes, the food, the routines, here's something for you listeners to consider. What's one small but genuinely significant change you could make starting today that could really boost your pet's long-term health and well-being?
It's a partnership, this journey to a healthier weight. And I think understanding what's happening under the surface really empowers us as owners and caregivers to make the best choices for their future.